Behavior Science for the Prevention of Child Abuse and Neglect. I'm not sure that you can see my webcam, my video, but I'm greeting you with a lot of enthusiasm. So my name is Mirela. I am Social Norms and Behavior Change Advisor in the team for Advocacy and External Engagement at World Vision International. And I feel very honored to be the moderator of this session today. Our session is organized under the flagship of our, you're going a bit fast, Brikenna, is organized under the flagship of our global campaign, It Takes a World to End Violence Against Children. And I am happy to welcome you. As you know, already the rules are that you mute yourself when you don't want to speak. If you want, we are going to be happy if you can introduce yourselves in the chat so that we are aware of who is in the room. Also, we are going to have generous time for questions. So we are going to ask you to use the chat right away or whenever you want to put your questions in there. So now we are going to discover the agenda of our conversation today. So if you see, we are having a lot of time for interaction. We intentionally wanted people to have a chance to meet each other. So we are going to have breakout rooms right at the beginning of our session. And actually, after we are hearing a few introductory remarks from our colleague, Bill Forbes. And afterwards, after the breakout room sessions, where I will give instructions about how to go about them, we are going to hear from the rooms a little bit, and then we are going to ask for your attention and patience for 30 minutes, because we want to share with you about a behavior change program that World Vision has been testing lately, which is called Nurturing Care Groups for Child Protection. And then we are going to go into the fascinating science and universe of uncovering behavioral determinants. We are going to hear about the barrier analysis that we have been doing in World Vision for child marriage and for child labor from our colleagues Teresa and Joel. As you see, we are going to have then a Q&A session followed by what we would like to call you to sign and to adhere to an SPC statement of this wonderful summit. And finally, we are going to have a plenary discussion with a couple of guiding questions, and then Bill will help us to close again. So this is the agenda for today, and let me now introduce the speakers very quickly. Brikenna, yes, great, thank you so much. So Bill Forbes is our global lead for child protection and participation, and he's going to deliver his introductory remarks and also the closing ones. Tom Davis is speaking after him. He is our global sector lead for health and nutrition. One of the most remarkable minds in the field of social and behavior change, and creator of the Bear Analysis tool, about which you are going to hear more from our colleagues Joelle Seman from Lebanon. She is the Program Development and Quality Director in this country, and also from Teresa Wallace, another fan of the barrier analysis tool, who is the technical director in child protection and participation in our organization. So this is it from an introductory perspective. Now I'm going to, if you can move the slide, that's great. I'm going to invite my colleague Bill Forbes for the opening remarks. And Bill, the floor is yours for the next 8 to 10 minutes.
Great. Can you hear me okay?
Yes, I can hear you.
Great.
Hi, Bill.
Hi, thank you. Hello, Mirela, and thank you very much for that introduction. Thank you, Pragati, and to ISPCAN. I've been looking forward to this summit very much, and even with the opening session, I had good reason to look forward to it. Many interesting things, and Bernadette, thank you in particular for that compelling presentation. Really appreciate it. Well, yeah, I'm going to jump right in because I know we're pushed for time a bit. So I started my career in the child protection field over 25 years ago. And of course, since the beginning, we've been focused on influencing people's behavior because that is what child protection is at its core. For many of those years, we have, and many of you have been walking along that's even longer, but for many of those years, what we most emphasized in our campaigns to end violence against children and our efforts to protect them from abuse and neglect was raising awareness, right? On the assumption that once caregivers and policymakers understand the information, they would change their attitudes and then their behaviors. There were powerful assumptions in that new information leads to new attitudes, which in turn will lead to new behaviors, the kind that we were promoting for protecting and caring for children. Of course, over time, we learned that things are more complicated than that. Behavior science teaches us that people are not perfectly rational human beings, and that sometimes the most compelling information will not generate the kind of change that we are striving for. Or even more interestingly, that people can even change their attitudes without actually changing their behaviors. Maybe, and you know, really as we reflect, possibly the most important or compelling lesson about the importance of behavior science has been provided by the recent events at the global level, in particular the pandemic, which highlighted once more the importance of tackling social ills with behavioral approaches. For a while, without a vaccine or efficient medication to fight and end COVID-19, the first and only line of defense was represented by changes in our behaviors, washing hands, wearing masks, etc. And the quicker we could change our behaviors, the safer we could become. And of course, the behavior questions continue with vaccine acceptance. And in the face of these challenges, a whole range of actors have recently increased their investments in the area of behavioral science. And a recent OECD review shows that currently there are more than 100 institutions applying behavioral insights into public policy around the world. Governments are increasingly recognizing the power and value of using a behaviorally informed approach to policy design. And also notably, on the 25th of June, 2021, the United Nations Secretary General launched the Behavioral Science Guidance Note. The guidance note calls for moving away from, quote, business as usual approaches to achieving the Sustainable Development Goals and using better methodological and practical transformation processes, which include applying behavioral science to project design. Donors are also increasingly recognizing the crucial role a social and behavior change approach must play in ending violence against children and child protection efforts, and a number of mechanisms are being explored or launched to coordinate efforts and promote learning. In child protection specifically, World Vision uses a systems approach to address the root causes of violence and to strengthen the protective environment around girls and boys. Our approach focuses on 4 domains of change. The first is empowering girls and boys with life skills, resilience, and psychosocial well-being, and supporting them to be influential protection actors in their environment. The second domain of change is strengthening services and support mechanisms and the capacity, coordination, collaboration of formal and informal actors to prevent, protect, and respond. The third is improving laws and accountability through advocacy at all levels and citizen voice in the quality and provision of services by service providers and duty bearers. And the fourth domain of change is transforming attitudes, norms, and behaviors of children, parents, faith communities, and community members while promoting positive and equitable norms and practices. So social and behavior change is one of the specific pillars of our approach to child protection, while also being a critical aspect across all of our efforts. Another point I would like to raise in these opening comments is that part of harnessing behavior science in our work is using rigorous measurement approaches. Behavioral science has really pushed us in World Vision and in the sector recently towards stronger formative and evaluative research to assure that our good intentions truly lead to a change on the ground. In an example that you'll hear a bit more about later in this session, in a recent World Vision project to lower harsh child punishment in Ghana, we found that 50% of the indicators that we measured in the control area where we did nothing improved. 50% improved where we did nothing. In the areas where we intervened, we saw much better results with 87% of the indicators improving. But just knowing that 50% of the indicators that we are measuring may be improving without any intervention on our part should be a sobering fact and remind us we have to be doing good, deep research and paying attention to context. It shows that we sometimes truly don't know if what we are doing is making a difference unless we use more rigorous research methods. Then we'll hear about some today. If we want to change behaviors to prevent child abuse and neglect, we need to understand the determinants, those factors that enable or hinder desired actions by caregivers, policymakers, and other relevant actors. We often think that we know what those behavioral determinants are, what determines people's behavior, but a behavioral science approach will always push us to use formative research to check, change, or verify our assumptions. In World Vision this year, we've started to use a specialized tool called the barrier analysis that you will hear more about today to help us better understand the drivers of violence against children, as well as continuing to explore the role of faith communities and other key actors in influencing behaviors with fascinating results. For us in World Vision, it was interesting to hear Samantha Power, the USAID administrator, during her June 2021 keynote speech to launch the UN's Behavioral Science Week. In that address, she made a few compelling points, and I'd like to quote one of them. Quote, "None of us are yet getting the most out of behavioral insights, and we will not get the most out of them. We will not optimize in our programming and in our leadership if we do not depart in critical ways from business as usual, from the way we're doing things now. Behavioral science is much more specific and more concrete than these broad ideas about meeting people where they are, about respecting local culture, about taking note of human behavior and adherence. Behavioral science is new. It is not old. It is not what we have been doing all along." End of quote. So for me, as the leader of the child protection sector in World Vision, I've been challenged over the last couple of years by the new insights that are emerging as we critically apply behavior science disciplines and tools to forms of violence, such as corporal punishment, child labor, and child marriage. And one of the challenges, as someone who is not an academic or a technical expert in the field of behavior science, has been to discern amongst the many voices and frameworks in behavior science what is the most valuable and relevant to child protection, so that we can then utilize those tools and frameworks for testing and learning in the field. If we are able to do that, to reach some agreement and consistency in language, frameworks, and tools as we apply this science to child protection, I think there's great potential for this to be one of the more profound contributions to our global child protection efforts are underway at this time. So we need this lens, the social behavior science lens, and we need these tools. Human behavior is not predictable. We need to acknowledge that and humble ourselves and really commit to learning why some people abuse and neglect and exploit children and others do not, and why our best efforts often do not have the impact that we are striving for, let's be honest, and how we can better focus our efforts on the elimination of various forms of abuse and neglect and other forms of violence against children. So that is why we're grateful for the opportunity provided to us by ISPCAN today to organize this panel, and grateful for your participation so that we can jointly discuss these very important issues. As Mirella said, we invite your honest reflections, your questions, your experiences, so that we can go beyond just surface level sharing and continue to strive for deeper understanding and to better focus in our child protection efforts. With that, I look forward to a thoughtful and fruitful discussion, and I'm happy to turn the session back over to you, Mirella.
Thank you so much, Bill. Those were fantastic insights, and we are very grateful to you for them. Tom, you're not starting yet. Just a second. We are still having something to, yep, great, okay. Bekena, if you can put our slides back. Because before we hear from Tom, we wanted to, great, thank you so much. We wanted to have a few breakout rooms. As I said, this session is going to be very interactive. So we want to send you in small groups. and to invite you to quickly introduce yourselves by sharing the organization's flagship SBC initiatives. In case you come from an organization that is using behavior science to prevent abuse and neglect and any form of violence against children, share those things with your colleagues. We wanted this session to be also a reason for inspiration and for us to gain new ideas. So what is a successful behavior change initiative on preventing child abuse and neglect, or child protection in general, that you admire? Talk in your groups about those initiatives, including from your own work. Don't be modest, don't be shy. You have bragging rights. So because we are a bit behind on time, I propose to our dear organizers to send us in breakout rooms, just a second, not as yet, for 7 minutes. So here on the slide, I said 8 to 10 minutes, but because of time, I propose that we only take 7 minutes in the breakout rooms. After the breakout rooms, Brikena, you can move the slide to show us what we are going to do. And what we are going to do is to share from a couple of rooms for a maximum of probably 4 to 5 minutes, what was interesting, inspiring, fun, thought-provoking, good to know, novel. So please go in the rooms, discuss about flagship initiatives, successful behavior change initiatives that you are aware of or you admire from your organization or from other organizations, and then come back being prepared to share something which was interesting, inspiring, thought-provoking from those rooms. So, dear organizers, are you ready to send us in the rooms?
Yes, and so they should choose one person to be their spokesperson upon return, correct?
Yes, but we have 33 rooms, so not everybody is going to get a chance to speak. Probably we will hear from 2 or 3 rooms at most, but it's a very good idea for each room to have a spokesperson in case they want to share.
Okay, excellent. So we're opening up breakout rooms now. Heather, if you can go ahead and launch that. Thank you so much, Mirella.
Thank you.
Okay. Hi, Mirella. Did you want me to close it in 2 minutes again now?
Yes, because it seems that people didn't join. So many sessions only have 1 or 2 persons. I have feedback from colleagues.
I was in a session with by myself. That's why I was
Yeah,
in room
exactly.
27.
Yeah, so it seems it doesn't work. So
Okay.
maybe we can
Maybe-
close this.
Yeah. So I think maybe we use less breakout rooms in the future, knowing that some people don't
Ye-
join.
Or we need to put like 20 people in a room to make sure that we have 5.
Yes. Okay, thanks, Mirella. So I'm going to go ahead and close
Mm-hmm.
rooms and bring everybody back. Okay.
Thank you.
Yeah.
We tried.
Yes. It's always helpful. Okay. So it's closing in 40 seconds. There's a countdown.
Yeah. So interesting. I was thinking that.
Yeah, it is. I'm wondering sometimes if polling makes it easier for people to participate in some way because they can just choose their selection and it gives some data and information, but I don't know. You live and learn through these meetings.
Yeah. So interesting that so many people didn't join.
It is, but you know, I think there were also some that had some good, must be some good discussions. I see. Let's see what happens. They're coming back now.
I'm not sure why I just got bumped back into here.
Yeah, because we are closing the
Okay.
sessions, Bill, because it seems that a lot of people didn't join. So
Okay.
yeah. Did you have a good discussion in your room?
We were starting, or we had started. That's okay. But
Can I ask?
Abhijay, I'm sorry that we had the interruption.
He's not hearing you. This is only for the presenters.
Okay. I'll send her a note.
Yeah,
Okay.
everyone is hearing you.
Okay.
Yeah.
So we are now back?
Yes,
Okay.
you're back. So I think everyone who had participated and has their cameras on, you're welcome to have the discussion. Mirella, everyone is back.
Okay, that's great. So welcome back from the breakout rooms. We tried. It seems that some people didn't join or found themselves alone in a room or just with 2 other people. I don't know how lively the discussions were, but I wonder if there's anybody who would like to share anything relevant from the breakouts. I saw that some rooms were pretty full, like 18 and 19 yes, Tom, you raised your hand. Go ahead.
Sure. So Jenny Rodriguez was in our group. She's done previous work in Bogota, especially with preventing violence against children in churches, working with faith leaders. That's something it reminded me how in the U.S. A lot of major denominations like the Methodist Church and United Methodist Church started a safe sanctuaries program that spread where, it changed things like not having just a male as a Sunday school teacher, but having males and females working together, putting windows on doors. Some of it involved some costs. There was some pushback, but really important way to help reduce violence against children. And it sounds like that is also spreading in Latin America, so that was good. And then Kishwar from Pakistan, she's in Karachi with Aga Khan Hospital, was just talking about how their system wasn't all that strong nationally, but they are making some difference and really focusing on parental awareness and positive parenting.
That's excellent. Thank you so much for this little report. And Alice, I see your notes in the chat. I'm happy that you could connect with interesting people, and we are very sorry that the time was short. Do you want to report anything from your group or anybody else wanting to report? I see that Esperance Sky raised her or his hand. Go ahead. Esperance? No? Okay. Anybody else wanting to share from the breakout rooms? Anything relevant, interesting, fun? No? If not, we will close this interactive session here, and we will go to your presentation, Tom. So if you can put your presentation on. Excellent. I see that you are working behind the scenes, and we just need you to put it in full presentation mode. Excellent. And in the meantime, if our colleagues want to share thoughts in the chat, thoughts from the breakout rooms, connecting with people that they just were happy to meet, please include those things in the chat. Now, Tom, the floor is yours for the next approximately 10 minutes. Go ahead.
Wonderful. Well, good morning and afternoon, everyone. It's really great to be here with you. I want to talk to you today about a project model that World Vision has been using to help end violence against children called Nurturing Care Groups. The Nurturing Care Group model uses a highly successful care group approach to promote behaviors at the household level across all 5 domains of the Nurturing Care framework. And the care group approach upon which this model is built has been shown to lower child deaths by about 32% at low cost, reduce malnutrition by 38% in some settings, and when compared to other community health worker-led behavior change approaches in 5 countries, it achieved double the behavior change and 53% better reduction in child deaths. That's when we're using it for health and nutrition. I was a co-pioneer of this approach, and in World Vision, we decided to see if we could get the same sort of results we're seeing in health, nutrition, and WASH in reducing violence against children. So with this project model, governments and organizations can choose from different behaviors to promote across the 5 domains of the Nurturing Care framework based on current adoption levels. And Dr. Henry Perry and I have been making the case over the past few years that if we want to scale up the Nurturing Care framework and the Thrive agenda, we need to have more and more countries using 2 tiers of community health workers. The current tier, who often work a few days a week or full-time, and eventually they should all be paid. And a second tier of volunteer community health workers who can focus mostly on behavior change with limited hours, about 8 hours a week or less. And without these 2 tiers, I don't see how we can address all of the things that we need to address to achieve the goals of the Nurturing Care framework without severely overloading community health workers. And that includes work in eliminating violence against children. So with the Nurturing Care Group model, you start with a census which targets all households or every household with a beneficiary, like pregnant lactating women and children under 5 or under 2. So there's a real flexibility on which households are included. Next, the caregivers in each group of about 10 to 15 households, look at the far right here, select that second tier volunteer community health worker who will serve them. These Nurturing Care Group volunteers are then trained every 2 weeks in groups of about 12, either by a paid Nurturing Care Group promoter who works with about 5 to 9 of these groups, or first tier community health workers who work with only 1 or 2 groups of volunteers. The groups of volunteers are the Nurturing Care Group, and the groups of the caregivers are often called neighbor circles. Now, the Nurturing Care promoters are supervised by a supervisor, and those are usually health facility staff when a community health worker is in that NCG promoter role. The Nurturing Care Group volunteers learn a new behavior promotion lesson every 2 weeks, and then they cascade that down to the households that they serve. So it's essentially a behavior promotion platform. Okay, now in the test of this model in Ghana, our staff promoted 6 child protection behavior lessons, shown here, which focus on reducing harsh punishment and dealing with caregiver stress. And I've shown a few of the images from the flip chart that we used. Since a new behavior is promoted every 2 weeks, the volunteers were able to complete this module in only about 3 months. So these results are based on an intervention that after the groups are set up, takes about 3 months. The same volunteers also promoted WASH behaviors in this project, and they had excellent results there as well. We have a full set of 15 publicly available Nurturing Care Group lessons to promote child protection, safety, and security, along with 51 other lessons to promote other sector behaviors. These lessons align with the INSPIRE framework, and the objectives of those lessons are shown here. Now, I won't go through all of these, but note that they include lessons around preventing child marriage and child labor, and recognizing and reporting violence against children. Note that we're also beginning to train all of our 184,000 community health workers worldwide in how to recognize and report violence against children. And Bill Forbes was very instrumental in getting that work started. So we used a quasi-experimental design for this study in Ghana, comparing intervention areas in Sabalugu and Sekietti East municipal areas of Ghana with nearby areas that did not receive the intervention, our control group. And we used a controlled before and after trial to limit a bias in assessing program impact, and it's good that we did. We calculated simple difference in differences to assess changes over the duration of the program. So we compared the change baseline to final in the intervention area to the change baseline to final in the control area. And substantial changes were seen in the intervention group, despite the fact that the study took place during one of the most significantly confounding events in history, the COVID-19 pandemic. While it's not possible to really disentangle potential interactions of COVID-19 and the intervention, for example, maybe there are synergies between program messages and motivation due to COVID-19, the differential impact of the program, given the context, is clear, as you'll see. So here's what we found when we compared caregivers reached via the Nurturing Care Group volunteers and those who were not. First, caregivers reached with Nurturing Care Groups were less likely to use 8 different forms of physical violence against a child. For example, to shout, yell, or scream at him or her, we saw a difference of 23 points between the intervention and the control group. To call him or her dumb, lazy, or another name, to shake him or her, to hit him or her on the bottom or elsewhere in the body with a belt, hairbrush, stick, or other hard object. That was a 25 percentage point difference. To hit or slap the child on the face, head, or ears, or to beat the child out. Also, Nurturing Care Group caregivers were also more likely than controls to often or always praise a child in 6 specific ways. They were also more likely to know and practice parental relaxation techniques, such as slow and deep breathing, stretching, imagining a favorite place, or singing a relaxation song, that sort of thing. Now, we didn't see any significant change in the use of some of the parenting techniques that we promoted, such as use of timeout or taking away privileges, but we did see a lot of the changes you see here. Also, caregivers reached with Nurturing Care Groups were also more likely to inspect their house for safety issues, but they weren't more likely to take action on safety issues, so we need to reinforce that lesson. They were also less likely to say that the punishment that they dole out depends on their mood. They were more likely to often or always report doing 8 different positive things with the child, such as volunteering with their activities and sports, playing games with the child, asking about school and homework, and inviting the child to help plan family activities. So you can see a lot seemed to change at this household level using this model. We saw much better increases in knowledge and beliefs that changed as a result of being reached through the Nurturing Care Groups, but I won't go through all these because, as Bill mentioned earlier, just changing knowledge and attitudes is not what it's all about. We need to see changes in actual practices, actual behaviors. One of the best things about this model is that it's easy to add on your child protection work to other sector work. Note that all of this child protection promotion work in Ghana was largely led and carried out by WASH staff, so water, sanitation, and hygiene. So along with the remarkable results we saw in reducing harsh punishment, our WASH staff were thrilled to also see significant improvements, the green lines here, in water quality, hand washing, and other hygiene indicators as compared to control. So it's like a 72% improvement in water quality, and you get the added benefit of making all this happen around child protection. So as we think about the future of child protection sector, as we close, we need to think about how to better leverage behavioral science. Nurturing Care Groups work because they're based on behavioral science findings including the work of Richard Cialdini, William Miller, Albert Bandura, Daniel Kahneman, and others. And we often use barrier analysis alongside of nurturing care groups and care groups, which can produce even better results. And we need to be looking at metrics such as cost per behavior adopted when we're comparing our outcomes. We also need to do better measurement and control of comparison groups in our child protection evaluations and research. As Bill mentioned, while we had much larger changes in the intervention group in the Ghana study, and about 87% of the indicators improved among those reached with nurturing care groups, about half of the CP indicators improved in the control group. So we need to use control groups. Lastly, we need to be paying attention to coverage and costs of different models in violence against children. This model reaches caregivers of children 20 to 26 times a year, with about 85% or more caregivers reporting contact by a care group volunteer within the past 2 weeks, both through home visits and group meetings. And it has a cost of only about $3 per beneficiary per year, and a cost per behavior adopted of only about 85 cents. So we need to benchmark other models against this and continuously test and improve our models. These are some of the links to the materials that we used. Feel free to reach out to me or to one of my World Vision Child Protection colleagues, Bill Forbes, Murillo Prea, to learn more. Thank you very much.
Thank you so much, Tom. That was very insightful. And we are now going to go into a next set of presentations, but then afterwards we are going to have Q&A. So I take the opportunity to encourage our colleagues to include their questions in the chat, and we are going to fish them out of there in the Q&A session. Thank you so much, Tom, for the time being. And now we are going to hear about uncovering behavioral determinants and the barrier analysis for child marriage and child labor and we are going to hear from Teresa Wallace, Technical Director for Child Protection and Participation in World Vision, of course, and Joel Seman, Program Development and Quality Director. I think that's the one to start is Teresa, right? So Teresa, the floor is yours for about 10 minutes or so.
Thank you so much, Mirella. And thank you. Yes, so we want to share with you now about our experiences using the barrier analysis tool that Tom Davis has mentioned. So we want to tell you a little bit about what this tool is, how we've used it both for child marriage and for child labor in Lebanon, and then some of the implications, learning, and next steps for us going forward. So yes, what is the barrier analysis? So the barrier analysis is a tool that was developed by Tom Davis, as Mirella said. It was developed in 1990 to help learn about respondents' beliefs around a particular behavior. It's been proven effective now around learning what those behavioral determinants are, and I'll show you what those behavioral determinants are in just a minute, and then how you can design social behavior change programs based on the findings. To date, wait just a second. To date, it's been used by more than 57 low to middle income countries, extensively by 37 different international organizations. What made us interested in using it as a formative assessment tool is that it provides you with statistically significant findings of those behavioral determinants. And that's unique in helping to inform the programming for the designers, for policymakers, for the practitioners, in helping you to think about the social behavior change programs that you're creating. And there's documented research now for health, nutrition, WASH programs of then the evidence of effective outcomes and even sustained outcomes that they've achieved. But to our knowledge, there's a little to no use of this for violence against children or child protection issues. And so that made us interested in trying the barrier analysis for our field of work. And so we're going to share with you our experiences so far for child marriage and child labor. Next slide. And so the barrier analysis is simple. It's a methodology that looks at a sample of 90 respondents using individualized interviews with trained enumerators. And there are 45 doers. Doers are those who are doing the positive behavior compared to non-doers, those who are not doing the positive behavior. Let me give you an example. Next slide. Sorry, go ahead. For child marriage. So here is the behavioral statement for that we put together for child marriage, and this is very important part of what you come up with. So we focused on fathers as the decision makers, as the doers, fathers who would wait until their daughters were at least 18 to marry fathers who would wait at least until their daughters were 18 years of age to marry them off, as compared to non-doers who would not wait until their daughters were 18. And on the right side of the slide there, you see the list of what I referred to as the behavioral determinants. These come from the health belief model and the theory of reasoned action. These form the foundation of the mixed method questionnaire. So that's another thing that drew us to the barrier analysis, because it provides very rich qualitative data as well as quantitative, but you do need to ensure that you have well-trained enumerators. As you all know, when you're doing any formative assessment where you're collecting qualitative data, both in the field during data collection as well as in the analysis, it's critical. Next slide. So this is now focusing here on the first barrier analysis that we did. This was a 4-country barrier analysis through a grant that we received. It's called the Enrich Grant, funded by the Government of Canada. You can see across these 4 countries, the prevalence of child marriage varied significantly from 16% to 59%. So quite a wide variation. I also just want to note here that we focused the study in the district or county where the grant was being implemented. So the findings that I share with you are not representative of the countries at large. They're only in those specific areas. Next slide. Now, I am only going to have time to highlight a few things, unfortunately, but I really am trying to pull out our learnings around the use of the barrier analysis. So although each context was unique, there were some common themes that emerged, though, from using the tool across all 4 sites. And we did see here that self-efficacy and social norms were statistically significant. Both of those are behavioral determinants, and they were statistically significant across all sites. Perceived self-efficacy, just so you know, in barrier analysis is defined as an individual's belief that he or she can do a particular behavior given their current knowledge and skills. That will come up a number of times as I and Joelle share. Just to highlight a few things here, financial stability or instability was really the most significant driver of child marriage across the 4 countries. So that's one thing that, again, was valuable about the barrier analysis, is because you can get those statistically significant findings, you can determine the highest estimated relative risk. So for example, in Bangladesh, the highest estimated relative risk was financial instability, where the question around what made it most difficult to wait, non-doers said it was that it was difficult to wait because as their daughters got older, the dowry price just became too expensive for older girls. And that estimated relative risk was 24.8, which was the highest across any of the other behavioral determinants. So that's one value of using this formative assessment tool. Another I'll highlight here was around education. I think those of us who work with child marriage know the complicated relationship with education as a root cause in child marriage. But what I want to highlight here was that under the questions around culture, doers shared under qualitative data that mothers, this was from Tanzania, mothers are the foundation of the community. So if girls stay in school and become educated, then the whole community will be educated. So you can see how the barrier analysis being mixed method and providing rich qualitative also provides the enablers in that local cultural context that can inform effective social behavior change responses. Last slide for me. So I just, you can, yep, click through here. Actually, I think I have one more. Go back for me. Thank you. So I want to go into one specific area before I pass it on. And this was very interesting, what emerged across 3 countries, Tanzania, Kenya, and Bangladesh. And I think was an interesting finding for us. So it was around the behavioral determinant of self-efficacy. What makes it difficult for you to wait for the non-doers? And this were findings around their adolescent girls, concerns around fear of early pregnancy, concerns that their daughters would have sex before marriage, and increase concerns about their increases in sexual desire. And so if you go to the next slide, this is also tied, sorry, Brikenna, you can go ahead and go the next slide. Thank you. one more. This is also associated with this question that we asked on the questionnaire about, did you discuss with your daughter about pregnancy and ways to avoid pregnancy? And this was also statistically significant at 0.01 across 3 of the countries. So here you see that doers, meaning those who were waiting, were more likely to report yes, they would talk to their daughters about pregnancy and ways to avoid pregnancy, whereas non-doers would report no, they were not able to talk about pregnancy. So they're fearful, they're concerned about their daughters getting married, they're concerned about the sexual desire and them having sex, but they're not able to discuss ways to avoid pregnancy. And so I wanted to highlight here 2 models, then exactly what we're talking about today. What are 2 social behavior change models that then could be used in a way of adapting them to a local context, but what are models that could be used to address this? The first is the one that Tom already shared with you. We, since the Ghana pilot, we have added 9 additional lessons to that model. But the entire nurturing care group child protection module is based on the goal of strengthening the parent-adolescent relationship. So that's the overarching goal, and we measure that in strengthening the adolescent-parent communication. And in addition, there are sessions within that module about healthy relationships, about talking about sex, and about discussing between the parent and the adolescent when is the right time to get married. So that is one model that could be used here. The second model is coming at it from the other way and working with adolescents. And this is a club-based model working with 12 to 18-year-olds. And it's based on a theory of both positive youth development, as well as David Kolb's theory of experiential learning, which is empowering young people to take charge of their own learning and development in a cycle of application, learning, reflection, and then that cycle once again. And within our model, we have
just be a channel. That's one of the reasons why timing is extremely important. But whoever will be involved
so within that approach, we have core content around healthy relationships and protective skills, as well as additional content around sexual reproductive health. And we encourage parental involvement then in those club activities, again, strengthening those parent adolescent relationships, knowing that is also key to behavioral strong behavioral developmental formation. So with that, I'm going to pass it to my colleague Joelle to talk about our experiences with the barrier analysis in child labor in Lebanon. Joelle?
Thank you, Teresa. Hello, everyone. So I'm gonna share with you our experience in Lebanon. We decided to do the barrier analysis for child labor among the Lebanese population. The reason why we chose to specifically focus on the Lebanese population because child labor is on the rise in our context, specifically with all of the contextual changes that are happening, but it is not yet considered as a problematic issue, and it is still considered as a problem among refugee population or among migrants. So we wanted to look further into this topic and understand it better, so we are able to better tailor our programming accordingly. If you can move to the next slide. Yes, and the next one. So the behavior statement that we agreed on, or that we came up with for our barrier analysis was: caregivers of children aged 3 to 18 years old refrain from engaging their children in begging, street vending, or paid labor, which interferes with their schooling or alternate education. So as Teresa just mentioned, the behavior statement needs to be the positive behavior, or the behavior that we're trying to promote. So it needs to be phrased this way, which is refraining from sending their children to work. So if we can move to the next slide. I'm gonna dive directly into the results. So the estimated prevalence of the behavior, which is refraining from sending the children to work, is 89% among the Lebanese population. And as I said, it is still a relatively rare occurrence in the Lebanese context, but it is on the rise, and this is why we decided to investigate it further. And from our findings in the barrier analysis, these are the determinants that were significant. So these are the determinants that were different between the doers and the non-doers, between the parents who are sending their children to work and between the parents who are not sending their children to work, if I want to simplify and summarize our behavior statement. So we had significant findings in self-efficacy, perceived social norms, action efficacy, perceived risk, and perceived divine will. In the coming slides, I'm gonna go into more details about what we mean under each one of these determinants. So for self-efficacy, the question that we asked the BA participant was, what makes it difficult for you to refrain from sending your child to work? And what makes it difficult for people who send, or for parents or caregivers who send their children to work, is basically the economic situation or the financial factors. So the child's contribution to the household income is an important factor in child labor. And at the same time, because there is this perception that every person in the household, irrespective of their age, should be contributing to the household income. So there is the child willingness to support as well, which promotes further child labor. We asked as well, under perceived social norms, we asked the participant, do most people in your surroundings support your decision? So for the parents or caregivers who send their children to work, they reported that yes, they feel supported in their community and in their surrounding to send their children to work. And for the parents or caregivers who do not send their children to work, also they reported that they feel as well supported in their decision of not sending their children to work. If you can move to the next slide. We looked as well at the perceived risk, perceived action efficacy, and perceived severity. And these came out as significantly different between both groups. So we asked them as well, how likely is it that your child might be abused physically or sexually in general, not specifically in relation of child labor? So for the parents who send their children to work, they were 2.2 times more likely to believe that it is somewhat likely that their child will be abused, not in relation to the behavior, but in general, they are likely to be abused. When asked about perceived action efficacy, and the question was, how likely is it that your child will not be abused if you refrain from sending them to work? So caregivers or parents who send their children to work believe that their child is somewhat likely to be abused, irrespective if they will send them to work or not. And in relation to the perceived severity, how serious of a problem would it be if your child was abused? So for the parents or caregivers who send their children to work, they believe that it is somewhat a serious problem if their child was abused, but they did not consider it as a major problem if their child was abused. And finally, there is also the component of perceived divine will. So we asked as well the participant, do you think that God approves of you refraining from sending your child to work? So for the parents who do not send their children to work, they were 3.8 times more likely to say that God approves of their decision of not sending their children to work. And for the parents who send their children to work, they were 3.5 times more likely to say that they are not sure if God approves. So this is very briefly the results of the barrier analysis. And now, what does this mean to us, and what does this mean to our programming? So as you've seen from the results, the financial aspect related to child labor is only one component of the decision to send the child to work or not to send it. The community support, the perception among the extended family plays a big part. The severity of the child labor issue also plays a big part. So for us, this led us to when we want to tackle child labor, we focus on integrating education, child protection, cash and livelihood programming in order to be able to respond holistically to the issue of child labor. For example, we have introduced detailed session among caregivers, highlighting the risk of child labor, highlighting as well the risk around sexual exploitation. The barrier analysis as well helped us understand the greater role that the extended family or the community member or the faith leaders play in the decision to send the child to work or not to send them to work. And what we're doing now is that we will start including the Nurturing Care Group core project model, which my colleague Tom Davis talked about, and we will include the sessions related to CP. We will contextualize them based on the results that we have now from the barrier analysis. Another project model that we will be as well, we have already started implementing it, but we will keep implementing it, which is called Channels of Hope, which works directly with faith leaders to empower them to be more active when it comes to child protection and to advocate with us when it comes to the dangers of child labor and to better support communities in making the decisions that are beneficial for their children. Next slide, please, Bekena. What we want to do as well is to understand better the perception of parents in relation to child abuse and violence against children, because from the results that I have just shared, there is some kind of normalization of violence against children. Parents consider that maybe because it is very prevalent in our communities, so children will be exposed to sexual abuse or physical abuse, irrespective of sending them to children. So they do engage in these negative coping mechanisms, or maybe it could be because Lebanon is facing a lot of crises at the same time. So all of these stressors are pushing parents further into adopting negative coping mechanisms affecting child well-being. So we need to better understand the perception, the reason behind these perceptions, and tailor our programming accordingly. We will be working as well on producing evidence to better understand and to show the effectiveness of this multi-sectoral approach, relying on social behavior change models in order to be able to better tackle a complex issue such as child labor. And finally, we want to use this evidence to advocate among donors, to advocate among government entities on how these approaches are more effective and how we need long-term multi-sectoral programming in order to make a positive contribution when it comes to child labor. Thank you, Teresa, back to you.
Thank you, Joelle. Yes, so we thought that maybe we could just summarize some of the learnings around the barrier analysis. I think overall we found that it is a valuable formative assessment tool. We still have more learning to do around different types of violence and how it fits in with other assessment tools that we're using. It is definitely feasible. We found it feasible during the pandemic, and the enumerator training seemed to be easy to use. As I said, there can be challenges when there is limited capacity for enumerators on collecting qualitative data or for teams on analyzing qualitative data. But Tom has developed a simple Excel sheet to help on the analysis of the qualitative data to help simplify that process. On the second bullet point here, we know that with child protection issues, as you saw, we each tackled complex behaviors. We weren't tackling a simple behavior like hand washing. We were tackling a complex behavior like child labor or child marriage. And within those, there are multiple factors. And I wanted to highlight, especially around norms. And I'm thinking there of the social, cultural, gender, and religious faith norms that are embedded within many of the child protection issues that we are working with. And we're finding that supplemental tools are going to be needed. The barrier analysis does identify those social norms, but I believe that we're going to need supplemental qualitative or other tools to understand how to, what those norms are and how to address those norms. Joelle? The third one?
Yeah, so what we learned as well, which is not something very new, but it was a reminder that from the barrier analysis, and when we're looking at behavior and determinants, it varies a lot based on the population we're working with, the area that we're working with. So if we really want to design effective programming, we need to always listen to the communities and tailor our programming accordingly, because motivators and drivers vary a lot, and one size does not fit all.
Excellent. So thank you so much, Joelle. Thank you so much, Teresa, for this presentations. I saw that there were a number of questions which were asked in the chat, and my colleagues started to answer them already. So for instance, there was a question about the age range of children at risk of being involved in child labor in Lebanon, and Mike responded to that. Thank you so much, Mike. Now, I wonder if you have any other questions which were not already addressed in the chat. In case you do, please feel free to either raise your hand or open your mic and state your question. We have, unfortunately, very little minutes left into this session before we need to move to the next one. So any burning, interesting, urgent question from anybody? Sajjad, for instance, Sajjad Ahmed asked, or actually it was a sentence without the question mark, but he mentioned that parents are concerned with how to respond to problematic and harmful sexual behaviors. That was a very interesting point. And I wonder if anybody in our team is willing to answer to that point in writing or orally. Or in case there are any other questions. No? Well, I don't see any other questions. I don't see hands raised. So in that case, we are going to move forward, and thank you for all those who answered the questions into the chat already. In particular, I want to draw the participants' attention to a contribution in the chat from Tom Davis, who provided a link to a Google Drive folder that has many barrier analysis resources, a training manual, a practical guide in various languages, and that might be very useful for those who still want to learn about this tool. Okay, so thank you so much. Let's move to the next point on our agenda. So we are seeing, as also Bill mentioned in his introductory remarks, that there is increased interest in behavior science around the world. We are saying on this slide for a second, Brikenna, in presentation mode, and there's renewed interest from a variety of actors about using behavior science for fighting various social ills around the globe. Unfortunately, every 7 minutes, a child dies as a result of abuse, neglect, and violence. And we were happy to see that in June, the UN Secretary General launched the Behavioral Science Guidance Note, urging all colleagues to explore and apply behavioral science in programmatic and administrative areas. Now, what we think is that behavioral science has been already leveraged to understand and change abusive, neglectful, and violent behaviors against children. That is a very good thing. We see that in the INSPIRE framework, for instance, the whole N into the INSPIRE acronym is about social norms. So this implies social change. However, it's very obvious to us that much more can be done. So this is why we are calling for the audience of this group. We are calling for you, in case you also feel like us, like we feel in World Vision, that much more can be done. We would like to put out a statement out there to call for international stakeholders to increasingly recognize and prioritize research and investments in harnessing behavior science and funding social and behavior change programs and interventions for protecting children's rights and fighting all forms of abuse and violence against children. This might represent, if we collect a significant number of signatures on this very short, brief, concise statement, could represent an interesting advocacy tool in our hands that we can use in the future, again, in case we are collecting sufficient or significant number of signatures. Brikenna is going to include the link to this statement into the chat. It's already there, actually. And in case you want to support this statement that has been agreed with ISKCON, we are kindly inviting you to click on that link and fill in your details. We are only asking for name and surname and organization, so it should be very, very quick and swift to fill it in. Because we feel that in the future, much more advocacy work around the use of behavior science for preventing abuse of the abuse and neglect of children might be excellent to have. Now, thank you so much for that. We have very few minutes now for a few plenary thoughts. We want to drop here 2 or 3 questions for the consideration of the entire group. So our questions are: what could our community of child protection professionals and enthusiasts do to better harness behavior science for the prevention of child abuse and neglect? What else? What more can we do? Or how can we continue to strengthen social and behavior change to prevent child abuse and neglect? Any strategies, any creative ideas? What insights would you like to share? What are some of your creative ideas? I would like to open the floor for a few reflections from the audience, from you. You have been very patient and heard a lot of information. Now, what are your views about these 3 questions? Please feel free to open your mic or to raise your hand. Yes, Tom. These are individual sign-ons for the time being, because we wanted to keep it as simple as possible for this SBC statement, because of course we understand that people to sign on behalf of the organizations, they would need to go back to the organization. It would be interesting to have also an SBC statement at some point on behalf of various organizations, but that's a next step. I can hear that somebody is preparing to speak. Go ahead. No.
Okay, my name.
Yes, Maria.
Okay.
Go ahead.
Well, I'm from Chile, and unfortunately, I came back to my country in 1995 from the United States. I worked in several programs there to prevent child abuse and neglect. But unfortunately, like I said, in my country, there is no prevention programs. Mm-hmm. Unfortunately, the people who works in the field of family and infancy just start doing intervention after a family judge decide to that the family has to be in a special program after the child abuse and neglect, especially physical abuse and in some cases sexual abuse had occurred. So that's something that my country needs to work a lot.
Yes, thank you so much, Maria. That was important to hear about. Any other thoughts?
Yeah, this is Rajiv from India. You're doing awesome work, and thank you for these presentations on very complex topics such as child marriage and child labor. All these evils are rooted in poverty, illiteracy, ignorance, and it's really, really very difficult to approve just by behavioral sciences in my community, because you need to address poverty. The COVID led to so much poor people just wanting food. Everything was closed, things were shut down. The integrated child centers, the schools, everything was closed down. So reaching out to the families has been very, very tight in the COVID times. And I just wanted you to address that part, how these can be implemented during the COVID times, and how to take care of those root causes of poverty, illiteracy, ignorance, and especially where child welfare services from the government do not reach in these regions. Because as an NGO, you can do only so much.
Mm-hmm. Yeah, that's a very good point that you raised. Thank you so much for raising that point. Anybody else wanting to respond to what Rajiv said or anything else?
I would like to add something.
Yes, go ahead, please.
Okay, my name is Deborah. I feel like the term consent is where we're stuck and hung up, seemingly worldwide from what I know. It needs to be strongly identified, obviously, in the court system, but also for people. And age of consent, what consent is really needs to be taught in schools. And it obviously, in America, it varies from state to state, and it's incredibly low in many states and horrific. But that is, I feel as though we're stuck on just what is consent, because the reality is when it comes time to trying to prosecute someone or do anything, it's very hard to prove abuse, and it just is, particularly in child abuse.
Yeah, we got the point. Thank you.
All right,
thank you. Thank you so much.
How do I mute myself?
How do you what?
How do I go back to mute myself?
I got it. Marella.
Okay.
And then you have two more people who have raised their hands, Elda and Jacob, if they would like to make their point.
Yes, and I'm afraid we are only having time left for one more question or one more statement. So who goes first, Jacob or Elda?
I can go, I guess.
Yes, go ahead, Elda.
I just wanted to, I work with the Women's Center in Massachusetts, and right now what we're big on is education and advocacy as much as we can. So, and building awareness. So we do parenting groups, we're connecting with the schools to do groups to educate kids on healthy relationships, dating. I think all of that plays a role, and just finding different ways to reach the children to help them find a voice. So again, I personally am writing books to kind of help kids understand that they're made for more as well. So again, there's so many different ways. And I think that if we just start small, then and we make little impacts, then it goes a long way. So again, I'm a therapist, but I'm just sharing from that clinical perspective that education and outreach is very powerful.
Thank you so much, Elda, and also congratulations for your writing. That is very, very important. Colleagues, I see that many other people raised their hands, and I'm afraid that the time is very limited at this point. So please put them into the chat, and we are going to respond to them, because now I would like to turn it over to Bill again for his closing remarks. Bill, the floor is yours, and you have exactly 1 or 2 minutes.
That's all I need. I think we've had plenty already of really interesting and provocative ideas and interaction. And I wish we were around tables and we could carry this on over lunch or something, but I really have enjoyed this so much. Just a couple concluding ideas. One is this conversation is not finished. The relevance of behavior science perspectives and tools and lens on our efforts to end violence against children and to protect children from child abuse and neglect is clear. There's deep relevance here, and we are all working very hard to prevent child abuse and neglect, but often in ways that have a lot of implicit assumptions in them, honestly, or are just the ways that we've been doing things in the past. So I would really, first of all, I think the relevance of behavior science to our work is very clear. Second, we should not assume the determinants of behaviors. We know there are some drivers that are fairly common, even like poverty, etc. But when we go to a particular context and we compare in that very one singular context, those who are doing the behavior that we want to see and those who are not doing them, we find that the drivers are not the same from context to context. And that when we understand what's the difference between people who are marrying their children off or not marrying them here or there, same with child protection, or with our harsh punishment, or with child labor, etc. When we understand that difference, we can better shape our efforts to message, whether we're a pediatrician or a development worker or a community health worker, that we are able to better target our messages toward what in this context seems to be the difference between these types of behaviors that we're trying to influence. And then finally, the point, I think, around integrated efforts, we're bringing together, we heard today about efforts where health, water, sanitation, and hygiene, mental health, child protection, bringing these things together and scaling them up in a more integrated fashion rather than as sort of distinct projects that are kind of all over the place. I think that makes more sense for families, more sense for governments, and will have a larger impact. But I just continue us to keep thinking, or encourage us to keep thinking and keep looking as we work, to keep investing ourselves in formative research and in critical evaluations and critical reflection as we work as individuals and as organizations and institutions. So thank you very much, Pragati. Thank you, Mirella, for hosting us so well and keeping us going on time. That's never easy, but you do it with great joy and kindness, and I appreciate that. But yeah, particular thanks to ISPCAN for this whole World Summit. We're very grateful for the chance to keep learning and pass the torch to the next presenters and see what next session, and we're looking forward to that as well.
Thank you so much. Before we are leaving this session, I want to say that already a good number of us have signed the SBC statement. I'm very grateful for these contributions, and I look in real time, the numbers keep increasing. So thank you all very, very much to ISPCAN for organizing this session and turning it over to the next set of presenters.
Yes. Thank you all from World Vision. Thank you, Bill, for your leadership, and Mirella for moderating today. You're a great partner of ISPCAN, and we're so glad to have you. Behavioral change is the most important and the most difficult for us to address, but